Hello, and welcome to our presentation. We will be presenting our proposal for the implementation of a remote patient monitoring system for patients with congestive heart failure on behalf of the Heart Function Clinic at Lakewoods Memorial Hospital, located in Lakewoods, Manitoba.
The Lakewoods Heart Function Clinic is a community care clinic affiliated with Lakewoods Memorial Hospital, located in Lakewoods, Manitoba. The clinic is dedicated to providing guidance and treatment for patients suffering from congestive heart failure. Currently, patients schedule routine appointments to come into the clinic to have their vitals assessed and medication modified as deemed necessary by the nurses and physicians. Despite the staff's continued efforts to ensure patient attendance, it is common for patients to miss their appointments due to transportation issues and weather conditions. In the past year, there has been an alarmingly high incidence of patients being readmitted to the hospital due to exacerbations. These readmissions have a significant fiscal impact on the community. The solution we propose to this problem is remote patient monitoring. Remote patient monitoring allows clinicians to remotely monitor patient vitals and identify early warning signs in a timely manner to avoid worsening of symptoms and overall condition of patients. A remote patient monitoring program for congestive heart failure is not designed for indefinite use. Ultimately, once a patient's condition is under control, the goal of this solution is to educate and instill self-management skills that will remain with the patient long after they have concluded their course with the program. Currently, there are approximately 600,000 Canadians living with congestive heart failure, which imposes a severe financial burden on the Canadian healthcare system. The incidence of congestive heart failure is expected to increase, with assessments implying a threefold increase in heart failure hospital readmissions over the next decade. As incidence of CHF continues to increase, the cost of hospital readmissions alone contributes significantly to the overall cost of this disease. Each hospital readmission costs roughly $11,000 due to the chronic nature of congestive heart failure. As a result of CHF's prevalence and large economic burden, it is prudent to seek out methodologies that will effectively facilitate prevention, treatment, and monitoring of the heart disease. Cardiac medicine experts suggest daily monitoring and tracking of patient symptoms to avoid exacerbations resulting in hospitalizations. The benefits associated with employing remote patient monitoring at the clinic include improved patient compliance and satisfaction, increased quality of life, reduction in hospitalizations and emergency room visits, decreased caregiver burden, and a decrease in healthcare costs associated with readmissions.
The usual treatment for patients with CHF involves teaching patients how to assess their own vitals and take their own weight daily. This often creates problems due to compliance and the patient's understanding regarding how and when to measure their vitals and when to call the clinic based on the values obtained. Patients visit the clinic regularly for their scheduled appointments, for regular echocardiograms and lab testing, and occasionally visit the clinic as needed for adjustments in treatment if they are able to recognize changes in their daily assessments. However, some patients with CHF are repeatedly admitted to hospital or treated in the emergency department for management of symptoms. Treatment is reactive to these exacerbations and leads to lengthy hospital stays and greatly impacts a patient's quality of life. With advances in telecommunication, we now have the capabilities to monitor patients in their own home using telemedicine. In the treatment of CHF, remote patient monitoring gives us the opportunity to design care that is proactive rather than reactive in nature. We are able to prevent acute exacerbations before they happen, resulting in less visits to the emergency department and a decrease in hospital readmissions. Initiating this program at the Lakewoods Heart Function Clinic would involve hiring a nurse practitioner to lead the program, as well as two more registered nurses to do home visits and analyze patient data in the clinic. Remote patient monitoring for CHF involves the use of wireless devices to measure vital signs, weight, and assess symptoms using customizable health questionnaires. There is less need for physical exams in the clinic, and clinicians are able to assess patients remotely using these technologies. Therapy is proactive and personalized in nature. Adjustments to a patient's treatment plan are made based on the daily assessment variables. Patients who are eligible for a remote monitoring program fit within the following criteria. They are over 18 years of age, have a diagnosis of CHF, have had at least one hospital admission or visit to the emergency department due to disease symptoms or exacerbation within the last year, require daily monitoring, are capable of learning new technology and instructions, and live in a home with access to internet or phone line. However, many systems have on-board cellular, which eliminates the need for internet access in the patient's home. The process of enrollment into the remote monitoring program is assessed during a CHF patient's first visit to the heart function clinic. The nurse practitioner assesses the patient's eligibility and sets up an initial home visit for education and hardware installation, done by a nurse within the program. The patient then performs a self-assessment and questionnaire daily using the hardware provided. This data is transmitted and analyzed by software in the clinic, and treatment is adjusted based on this data. Patients are monitored remotely for a variable length of time, depending on their medical stability and whether or not they are able to continue unassisted self-monitoring. Daily assessments of systolic and diastolic blood pressure, pulse rate, body weight, and oxygen saturation are taken in the patient's home. The patient also answers questions pre-programmed into their device. All of this data is analyzed by software within the clinic. Immediate alerts are generated based on parameters set by the healthcare team and can be customized to each individual patient. The Lakewoods Heart Function Clinic sees approximately 200 to 300 patients with heart failure each year. About 20 to 30% of these patients have repeated hospital admissions and visits to the emergency department for complications and disease exacerbations. Currently, 3 cardiologists work out of the clinic, as well as 2 nurses and 2 administrative assistants. The infrastructure of the clinic is well equipped to support a remote monitoring program, with the addition of a few hardware components and new software for assessment data analysis. The Gassert model for defining information system requirements for nursing was used in the system analysis of this project. This model consists of 5 linked elements: nurse user, information processing, nursing information systems, nursing information, and nursing system goal elements. Each element has both inputs and outputs. Within the user's element, the input is that the clinic staff will function as educators, training patients and caregivers how to utilize the RPM system. The output will be the effective utilization of the program by the end user, the patient. In the information processing element, the inputs are that the program will monitor and track a patient's daily weight, BP, oxygen saturation, and heart rate, as well as ask daily questions. The nurses will use the software to track, interpret, and trend patient data. The output is that the clinic staff will have the ability to interpret the daily readings based on set parameters and nursing judgment, followed by appropriate interventions. In the nursing information system element, the inputs involve analyzing the patient's assessment data. To facilitate this are customizable parameters individual to each patient. The output is that there is universal interpretation of readings across the clinic. Within the nursing information element, the inputs are that the nurses will collaborate with the patient and hospital to have all elements of the patient's electronic record available in their clinic profile. The outputs is that the team will have a complete health record. Within the nursing system goals, the inputs are having daily record of patients' vitals and disease indicators to ensure effective CHF management. The outputs are that the ultimate goal is to promote adherence to an effective CHF management plan, improve the quality of life for CHF patients, and reduce hospital readmission rates and visits to the emergency department.
Prior to the implementation of any new system within an organization, a thorough examination should be performed to ensure that the system is feasible for all the parties involved. To assess for economic feasibility, we first itemized all of our expenses. After doing so, we estimated that the total startup cost to employ remote patient monitoring at the clinic would be roughly $333,960. The return of investment or ROI methodology is the leading technique used to measure information technology success. We utilized a web-based tool designed by the Center for Technology and Aging and the Center for Connected Health. The calculations produced suggest that this endeavor is feasible as the 5-year projections for the ROI indicate a linear increase is expected in total returns. These projections are based on the assumption that patient outcomes will benefit with the implementation of this program by reducing readmission rates by 10 incidences per year.
To run the remote monitoring program, we have chosen to use the products from the Enterprise Telehealth Division of Philips Canada. The Philips Chronic Ambulatory Care (ECAC) program combines clinic software with in-home monitoring technology. These technologies help patients to learn how to manage their own condition and allows our team to monitor patients daily from the comfort of their own home. We are able to personalize each patient's care plan based on their individual needs. Hardware components of the ECAC program include a digital weight scale, a wireless glucose meter accessory, a pulse oximeter, a blood pressure monitor that includes a pulse meter, and an e-care companion tablet that offers multiple language support and assists patients and caregivers with all aspects of the program. Not all patients will be required to take their blood sugars using the wireless meter accessory, but this accessory is available for patients that do. Additional hardware needed within the clinic to run the program is rather minimal. We will need an additional desktop computer located in the nursing office to operate the software needed to analyze the patient's assessment data. We will also need a database server to securely store patient information specific to the remote monitoring program. A laptop for the nurses performing home visits, as well as a BlackBerry, is needed to run the program. The updated clinic layout map shows the location of the additional hardware needed within the clinic. The eCare Companion software is loaded on the patient's tablet. This program allows patients to submit health questionnaires, participate in video calls with their care providers, and receives assessment data wirelessly from the other in-home devices. Patients log into the tablet using a code, and these tablets operate on lockdown mode, so that they cannot be used for any other purpose other than the operation of the eCare Companion app. The right side of the screen shows examples of the patient's desktop within the program. The software platform that will analyze and monitor the patient's assessment data is called eCare Coordinator. This software is able to combine the subjective assessment data from the health questionnaires and surveys with the objective data in the daily assessment values provided by the patient. The software is customizable for each individual patient, allowing the healthcare team to set alert parameters that make sense. The right side of the screen shows examples of the eCare Coordinator desktop. Implementation of this project will be completed in 4 phases. The first phase involves hiring of new staff, developing the program, system testing, and involvement of representatives from Philips Telehealth. The second phase is the education phase. Clinic staff will be provided with formal education, and Philips representatives will provide support for 1 year following project implementation. In the third phase, the remote patient monitoring program will begin. Hardware and software will be set up and running, and data will be analyzed and treatment adjusted. In the final phase, we will evaluate the results of the program, make any necessary changes and adjustments, and report back to hospital administration about the results, hopefully to obtain approval for expansion of our program. Implementation of the remote monitoring program will happen over a year's time. We will start designing the program in August of this year, start the education component in October, and have a go-live date in March 2017. This will be followed by a formal evaluation phase in August of next year. On the right side of your screen, you can see a detailed implementation timeline. To achieve the promising gains of utilizing the ECAC program, an education plan was developed using ADDIE training methodology. ADDIE is an acronym for Analysis, Design, Development, Implementation, and Evaluation. The entire education phase is proposed to run from January to February of 2017. A detailed curriculum with instructions of how to operate the system and how to interpret results and alerts generated by the system will be created. By utilizing multiple flexible teaching approaches, we will be able to maximize the relevance of training. Presentations, handouts, role play, and teach back methodology will be used to assess usability, and the opportunity to ask questions at the end of each learning session will be provided. Evaluation forms will be completed online at the end of each class to receive suggestions and feedback. Evaluation and usability testing will be done at the pre-implementation phase to identify potential problems that might evolve during the implementation process. Identifying these problems earlier will foster better performance before introducing it to the end users. This will avoid wasted time and resources and promote system efficiency. The System Usability Questionnaire will be used to give Philips Telehealth representatives and IT personnel the opportunity to review the system and make changes as needed for better system performance.
A risk analysis was performed to identify potential issues with the implementation of this program. Economic issues include the need to produce funding. Financially, the startup cost estimated to implement the remote patient monitoring program at the clinic is approximately $333,960. Our goal is to apply for funding from the Canada Health Infoway and from the Centre for Chronic Disease Prevention, as they both offer grants for innovations in consumer health solutions. The issue of security and privacy is of great concern within the healthcare application industry due to the sensitive nature of the information being handled. To prevent major security breaches to the network, ECAC will employ two broad-level security measures: encryption and authentication mechanisms. All communication and access to personal information via the hospital network will be encrypted, ensuring a third party cannot access the information unless they can provide appropriate authentication. This program is targeted at those with chronic congestive heart failure, and generally speaking, these individuals tend to be elderly. Introducing technology into their daily lives will be challenging. To overcome this hurdle, a nurse will be paired up with each patient to educate the patient about how to utilize devices included in the program. After 1 week, progress will be assessed to determine if the patient requires further education or if they are no longer suitable for the program. Another social issue that may arise is staff resistance to the initiative. Failure to adopt new technology within the workplace, even one with clear benefits, is common. To prevent resistance, the clinic will ensure proper education is provided for all those involved in the program. The implementation process will ensure involvement of all staff to measure usefulness of the system and focus on clinic's objective to reduce costs and hospital readmission rates. Connectivity issues, should they arise, will be addressed directly by the Philips technical support team, whose services are included in the cost of the hardware purchase. The nurses at the clinic will be notified of any lost connections through an alert system built into the software.
This presentation has proposed a remote patient monitoring program as a promising informatics solution to address the problems associated with the efficient management of patients with congestive heart failure. Environmental analysis and return on investment calculations reveal that initiating this program at the Lakewoods Heart Function Clinic will reinforce effective heart failure management, improve the quality of life of our patients, and reduce hospital readmission rates. To successfully implement the program, education will be provided to clinic staff and usability tests will be completed prior to enrolling patients in the program. Implementation of this program has numerous benefits to patients, staff, and the healthcare system. We appreciate your interest and support in our remote monitoring program, a promising informatics solution for patients living with congestive heart failure. Thank you.